5 signs that you need a new doctor. Not because they're not a good doctor, but because they're not good for you. This is from a doctor that works with doctors all day. Can you spot the signs? Let's go. Number 1, they're not making eye contact. Look, eye contact is very important in human communication. It sends the sign that I'm here. I am present. I am ready to be with you. I'm all yours. If your doctor cannot give you simple eye contact, that is a red flag. They're in there, they're looking at their phone, their chart, their computer, the nurse, looking at everything but you while you're talking about your needs. Whether this is intentional or unintentional, it needs to be addressed. Maybe find a doctor that can look at you. Dang, they're dismissive. You say something and they're like, okay, yeah. You'll be fine. You know what to feel like to be dismissed. And you also know that is exactly what is happening. But let me tell you something. A doctor should not be dismissing your concern. Here is the simple truth. You are in your body 24/7. You know what's going to happen before it happens. You feel everything. You can't be in your body all the time and expect somebody in 15 minutes to diagnose you correctly. So everything you feel, everything that is off is a data point. Any doctor that does not see it this way is putting themselves on the wrong side of the 8 ball. Next, lack of understanding. Have you ever been talking to somebody and when they respond, you're like, are we in the same conversation? Are we talking about the same thing? If that is happening with your doctor more often than not, then that is a sign that you may need a new doctor. Because you need a doctor with whom you are able to communicate your needs effectively with the least resistance. If you're coming in talking about back pain and they're saying that you need to exercise more, they could miss something. If you say that your tongue feels a little swollen whenever you take a medication and they're saying you need to drink more water, hello, are we talking about the same thing here? Find somebody that can understand you and actually wants to understand you. Dang. Inability to communicate the plan. Let me tell you something. Most doctors know what the plan is before they leave the room. In fact, many of them know what the plan is before they even enter the room. They have enough data points to know what they're going to do. And it just takes a little bit for them to share it with you. Do not think this is a tremendous effort that cannot be undertaken. If they're going to be changing your medications, they need to communicate that with you. They need to tell you what to look out for. If they're going to be referring you to a specialist, they need to communicate that with you, along with what you need to be talking to that specialist about. You should not get home and be surprised by what you see, by what they've done. Now, here's the thing. This is not always intentional. Sometimes you get back and you realize something, that something needs to change. But once prompted, they should be able to fill you in with the plan. Oh, okay, I increased your lisinopril because I noticed you've been running high and I'm not going to see you for another 6 months, so let's just do it now. It's just that simple. Bringing me to my next point. Next. They can't say that. Now, they don't have to use these exact words, but any healthcare provider that cannot acknowledge that they are wrong. Well, we know we all make